Hello, and welcome to our live webcast, Physiological Adaptations with Exercise. Thank you for joining us. My name is Lisa, and I will be the operator for the presentation tonight. Before we get started, I would like to just take a moment to acquaint you with a few features of this web event technology. On the right-hand side of your screen, you will see the text chat window. There is a large window which holds all of your sent messages, and a smaller text box at the bottom where you will type in your questions. To send a question, click in the text box and type your text. When finished, click the send button. All questions that you submit are only seen by our presenter. Your questions will be responded to in the order in which they were received and will be addressed at the end of the presentation. At the conclusion of today's program, we also ask that you complete a brief post-event evaluation. Please take a moment to complete this survey in order to receive credit for providing feedback and attending tonight's webinar. We are joined today by our speaker, Dr. Matthew Bassan, who is a specialist in musculoskeletal medicine with Atlantic Medical Group's Ortho-Care Wayne and fellowship. He is trained in sports medicine with nearly a decade of clinical experience in non-surgical orthopedic care. At this time, I would like to turn the microphone over to our speaker, Dr. Bassan, for opening remarks.
Thank you. Thank you for having me. As mentioned, I practice sports medicine in Wayne, New Jersey with Ortho-Care Wayne, part of Atlantic Medical Group. I'm originally trained in family medicine and did a specialty fellowship in sports medicine. So I do non-surgical musculoskeletal care as well as some weight loss. So today we're going to be going through the physiologic effects of exercise. What happens to us when we exercise? Why is exercise beneficial? Exercise affects the whole body. So no matter what exercise you do, even if it's weightlifting, it can still affect the cardiovascular system. If it's running, it still affects the musculoskeletal system. So we're going to go through what those adaptations are, how it's beneficial, and what happens at a microscopic level. So here's an outline of the presentation. First, we're going to go through the subcategories of exercise. What is aerobic versus anaerobic? Cardiovascular versus strength training. The role of team sports versus individual sports. Then we'll go into detail about some topics that you may not have heard much about since biochemistry class, as in aerobic metabolism. What exercises will produce aerobic metabolism, and then the specific physiologic adaptations that occur in response to that exercise with aerobic training, both cardiovascularly and musculoskeletally. We'll then go into anaerobic exercise, starting with what is anaerobic metabolism, what exercises induce anaerobic metabolism, changes to the heart and musculoskeletal system with anaerobic metabolism. And then with these conclusions, we'll bring it all together to discuss what recommendations we can make for ourselves and our patients to live healthier lives. So first of all, what constitutes exercise? Exercise means different things to different people. A lot of times when I introduce myself to patients as a sports medicine doctor, if they are 80 or 90 years old, they'll say, oh, I don't play sports. I don't need a sports medicine doctor. Well, what is your sport? Your sport could be playing on a football or soccer team. It could be running marathons, or it could be doing yard work, going grocery shopping, walking to get the mail. There's a lot of different things that constitute exercise. A few things don't, such as sitting on the couch or sleeping, but most things constitute exercise that involve movement. So we're going to go through different examples of that. Types of exercise. Aerobic, meaning with oxygen. Aerobic exercise is exercise that induces aerobic metabolism, which we'll go through in a bit. This is often lower intensity exercise that depends on oxygen to produce energy over long periods of time. So think of exercise that's at more of a constant rate over a longer period of time. Anaerobic is higher intensity, shorter duration exercise. It bypasses the oxygen-dependent metabolism system, and it produces lactic acid as a byproduct. Other ways to categorize exercise are cardiovascular. Exercise, its main goal is training of the heart, vascular system, and lungs. Examples are running, cycling, swimming. I'm sure you can think of many others. But remember, even if that's its main goal, it still affects the whole body. Strength training, of course, that incorporates weightlifting. The goal here is to add muscle mass and strength. Different physiologic goals, different physiologic effects, both on the musculoskeletal and cardiovascular system. So team sports incorporate the psychosocial element of sports medicine, of exercise adaptations. So we look at the whole patient. I was always trained to look at the whole patient. So there's the physiologic adaptations, and there's also the psychosocial adaptations. In this slide, if you can all see it, those are my Baltimore Orioles. I'm from Maryland. They will hopefully be good once again one day. And so in this slide, we look at the psychosocial aspect. So being on a team is going to help keep someone motivated to exercise. It's going to encourage them to stick with it and to reach higher goals than they may ordinarily be able to do on their own. A team could even be two people. You may go to the gym with your workout buddy and push each other to do more in the gym and keep each other motivated. This can be a combination of the aerobic, anaerobic exercise. For example, basketball, you're running up and down the court. You may be running for long enough to induce aerobic metabolism, but you're also stopping and starting and sprinting. That would be an anaerobic component. All right, so just as a review, when you're not exercising, I'm sure we all know this, but the average heart rate is 60 to 80 beats per minute. It could go up to 100. Over 100 is considered tachycardia, and under 60 is considered bradycardia. This could be normal, especially for exercise-adapted people, which we'll go over. It decreases with age and increased cardiovascular fitness. So exercise effects of aerobic exercise on the body. Now we're going to go over aerobic metabolism. Aerobic metabolism may be reviewed for some of you, but it may be something that you remember from a while back. We start with the molecule glycogen. Glycogen is a storage carbohydrate. It's stored in muscle, and it's released during exercise. In aerobic exercise, it's broken down to its usable form, glucose. It starts with undergoing glycolysis, lysis meaning to break the molecule up, and that produces a compound called pyruvate. Next slide. Pyruvate then goes through something called the Krebs cycle. In the Krebs cycle, pyruvate reacts with oxygen. This is where oxygen comes in. This interaction of pyruvate and oxygen produces something called ATP, adenosine triphosphate, which is the energy unit of the body. For each one molecule of glycogen that's released from the muscle, 38 energy units of ATP are produced. That number will be important as we contrast it with anaerobic metabolism. The byproducts of aerobic metabolism are carbon dioxide and water. Next slide. So what constitutes aerobic exercise? Is tennis an aerobic exercise? Not really. Why? So why would tennis not be an aerobic exercise? It has a lot of stopping and starting. So you play a point, you run around the court, then you go and pick up the ball, you pause to serve, and then you run around the court again. That's not ideal for aerobic exercise. It has its benefits. But for aerobic exercise, we're looking for something that is nearly a constant rate over a longer period of time. These are classic aerobic exercises. If you think about when you go to a gym, formal gym, and you see people on elliptical, Stairmaster, treadmill, exercise bike, and they're on it for 20 or 30 minutes at a time, continuously moving, that is an aerobic exercise. Examples: long-distance running, cycling, a long-distance swim, cross-country skiing, things like a marathon or a triathlon. But again, we don't have to be doing a marathon or triathlon to get the benefits of aerobic exercise. You could just go for a walk for an hour, and if you're walking for the entire time, you're going to still get the benefits of aerobic exercise, albeit, of course, a little differently than if you were running the whole time. Okay, so this is an important equation in exercise physiology. This is the equation that the output of the heart, meaning what the heart puts out per minute, is equal to the heart rate times the stroke volume. So if we want to be adapted for exercise, we are training our hearts to put out more per minute. So the adaptations are going to have to come in the form of heart rate and stroke volume. So we're going to go over each of these now individually. So heart rate during exercise. As we all know, heart rate increases during exercise, but it doesn't increase exponentially. The heart can't beat at 400 or 500 beats per minute. That's going to cause it to shut down. So it increases until a maximum heart rate is reached. That maximum is different for every person based on age, but it can be estimated as 220 minus the age in years. So you can all take a moment now and estimate what your own maximal heart rate would be. So there is only so much oxygen that the body can take in that's available for consumption. So in order to get that oxygen around the body quicker, blood flow must increase to meet the demands of the cardiac muscle and the skeletal muscle. It's not only the skeletal muscle, we need to feed the heart in order to have it increase. So that's why ways to do that heart rate has to go up. And here's a chart where you can see heart rate does go up in proportion to the intensity of the exercise. Oxygen intake is the measurement listed here. That is a measurement of exercise intensity. And we can see that it levels off. In this particular patient, it's leveling off around the low 200s, so we're probably talking about a teenager here, maybe a high school athlete or college athlete, and then you see that it levels off. Next slide. So we know heart rate goes up during exercise. Stroke volume has to go up as well. Again, the heart rate can only go up so much. Once the heart rate gets to a point where it can't go up anymore, if you're going to run a marathon or whatever you're doing, you need more oxygen. So the stroke volume goes up. Stroke volume is the amount of blood ejected per beat of the heart. So in untrained individuals, it goes up until about 50% of what's called the VO2 max. This is an exercise physiology term for volume of oxygen consumption. You could think of it as an exercise intensity level. However, you can adjust this to level off not until 90% in endurance-trained athletes, to allow them to do their endurance activities. Next slide. Now we're going to talk about the Frank-Starling mechanism. So how does the stroke volume go up physiologically at a microscopic cellular level? Well, what happens is the heart rate goes up, blood is flowing better, quicker, and this engorges the cardiac cells so that they fill it with blood. When they fill with blood, it's like a rubber band. It pulls apart wider, and when something pulls apart wider and it's elastic, it snaps more forcefully, and that's what happens here. So the heart muscle will contract more forcefully, therefore it will eject more blood per beat. And so this is known as the Frank-Starling mechanism. So that is one factor that affects stroke volume. There are others. As I touched on, increased venous return simply from a faster heart rate will increased stroke volume also. Increased ventricular contractility has one other cause, which is an increase in sympathetic nervous activity. So our parasympathetics decrease, our sympathetics increase when we exercise. It's that fight or flight mechanism, and that allows for an increase in ventricular contractility. However, just like heart rate can't increase exponentially, stroke volume also can't increase exponentially. The heart would explode if it just continued to increase and increase and increase. So therefore, this system of checks and balances applies here in terms of decreasing stroke volume to make sure it doesn't get too high. So if we think about the heart, the chamber of the heart is large. The aorta is much smaller. The aorta being smaller, blood likes to flow from a high to low pressure system. In this case, it's flowing from a low to high pressure system. So there is some resistance from the aorta to get the stroke volume to not be exponentially high. Next slide. So this is a graph of heart rate in a fit individual seen in blue and an unfit individual seen in red. And what we can see here, first of all, is that the resting heart rate is lower in the fit individuals. The exercise heart rate is lower in fit individuals. In addition, the slope of the increase in heart rate is lower in fit individuals, and it returns to a steady state sooner. So, if we think about it, a slower rise in heart rate in fit individuals saves energy. a lower heart rate during exercise saves energy, and a faster return to normal saves energy. The less the heart has to beat quickly when it's not necessary, the more energy that's saved. That energy can be used for greater exercise. So next slide. In words, so a heart rate, again, lower in those who are aerobically trained. In these cases, the aerobically trained actually have increase in parasympathetics, especially at rest. It allows for them to exercise more vigorously, longer intensity, longer periods of time. And these adaptations can happen about 1 beat per week is how the heart rate lowers for each week that you train. And then in the trained state, we also go back to a steady heart rate sooner. So we'll touch on this later, but when I put a patient on an exercise program, and I do this a lot when I'm doing weight loss for patients, the first thing that they tell me when they come back for their first follow-up in 2 weeks after the initiation of the exercise program is that they have more energy. And nowadays, fatigue is a huge issue. It often comes hand in hand with patients that don't exercise. So the conserved energy is conserved to allow the person to exercise at higher intensity, longer duration, but it also allows them to feel more energy throughout the day. Next slide. So we're going to go through changes to the heart muscle with endurance training. There is less ventricular hypertrophy. A lot of you have probably heard of the concept of athlete's heart. The left ventricular hypertrophy is due to a volume overload, which means that the chamber of the heart is increasing because the stroke volume is increasing. Increased venous return, the blood is used to having more heart in the left ventricle. So the thickness of the wall increases and the size of the chamber increases. And this basically, you train your heart to beat faster, to beat harder, to eject more blood, you get these changes. Next slide. So that's the cardiac muscle adaptations. Here we talk about the skeletal muscle adaptations. There are three types of skeletal muscle fibers. Slow twitch fibers. A slow twitch muscle fiber has a high capacity for what we just talked about, aerobic metabolism. It's fatigue resistant, but they have a low capacity for anaerobic metabolism and low motor unit strength. A motor unit is basically the unit of the muscle connected to the nerve that gives it innervation to allow it to fire. So what these can do is they fire very slowly, but they don't tire out that easily. So we'll go back to discussing that the slow twitch muscle fibers were, again, the fibers that have good fatigue resistance but a slower contractile speed. Sounds like something you would use if you're running a marathon. So if you're running a marathon, you're able to continue running for long periods of time. However, you're not going to be running at a sprinting speed. Now we're going to go through fast twitch muscle fibers. There are actually two types of fast twitch muscle fibers, fast twitch A and fast twitch B, which is why I said that there are three types of muscle fibers. Fast twitch A, or the faster of the two, shall we say, it has a low aerobic oxidative capacity and a low fatigue resistance. Tires out very quickly. So the exact opposite of slow twitch. They have a high anaerobic capacity and a faster speed of contraction. So these can contract very quickly and then they tire out. Well, what does that sound like? That sounds like sprinting. It's a classic example. In sprinting, you're going to go very quickly. You're able to get to the finish line very quickly, but you can't run at that speed for a long period of time. You'll tire out. These have larger motor units with more muscle fibers connected to each neuron to allow for these highly organized contractions that allow for these quick bursts. Fast twitch B is similar to fast twitch A, except that it does retain some moderate aerobic capacity. We could even consider this in the middle of the two. Now we're going to discuss anaerobic metabolism. So the very first system that the body uses for energy is called the ATP-PC system, PC standing for a chemical called phosphocreatine. We talked about ATP. ATP is the energy unit of the body. So both ATP and phosphocreatine are at any given moment stored as a muscle in a very small quantity. They degrade very quickly. They can be reproduced quickly, but they only last about 10 seconds. So this is anaerobic too. Remember, anaerobic just means without oxygen. It doesn't necessarily need glycogen to be broken down. Anything that provides energy without oxygen. So what does this do? One movement, a golf swing, a tennis swing, a power lift, one baseball throw, something like that. You don't feel tired after doing it cardiovascularly. That's because you're using your stored energy. The next step after this 10 seconds is the glycolysis part of anaerobic metabolism. So the same way as aerobic starts, anaerobic starts with glycolysis. This system produces ATP, but you need the energy so quickly that you don't have time to go through the Krebs cycle to react with oxygen. That takes longer. A sprinter needs that energy right away, but this is wasteful. This produces 2 ATP molecules for 1 molecule of glycogen, in comparison to the 38 ATP molecules produced in aerobic metabolism. But it really doesn't matter. You need the energy quickly. You have to take whatever is available. So I compare that to fast food versus a fine dining restaurant. You may have a real quick lunch break and have to get food very quickly. You may have to go to a McDonald's or a Burger King. You may have time later on in the day to go to a high-end steakhouse. Well, I think the steakhouse food is going to be better than the McDonald's or Burger King food, but you didn't have that choice at lunch. You had to get something quickly. Well, that's the case here. It's wasteful, anaerobic metabolism, but if you're sprinting, that's the only energy you can get. You have to take it. This does have a byproduct of lactic acid. This produces the burning sensation. So if you sprint, you're going to have a lot more burn in your legs than if you are running at a slower pace. That's because of the lactic acid produced. This is used for sprinting, but it can also be used for that late kick in a race. So if someone's running a marathon, but they're able just that last 1 minute to sprint at a faster rate, they're kicking in their anaerobic metabolism. So again, anaerobic exercise is short duration exercise, generally at a higher intensity than aerobic exercise. Sprinting is the classic example, but there are several examples of this. Strength training, weightlifting. Again, if you're doing one power lift, you're probably using the ATP-PC system. If you're doing a set of 10 bench presses, you'll go into glycolysis, but it's still anaerobic. A 50-yard dash, if you watched the Olympics this past summer, you saw things like the 1,500-yard freestyle, 1,500 meter, and the 50-meter freestyle. Those are using very different types of metabolism. So, what are the exercise adaptations for muscle fiber makeup? The average person is born with about 50% slow twitch fibers and 50% fast twitch fibers. The fast twitch fibers are divided into fast twitch A, 25%, and fast twitch B, 25%. And with anaerobic training, you can get more fast twitch muscle fibers. You can increase them in relation to slow twitch muscle fibers. The opposite occurs with aerobic training, where you'll get more slow twitch fibers than fast twitch fibers. So again, the more you train, let's say you're training to run marathons, you can change this to get into a greater amount of slow twitch fibers, which will again help you run more miles at better times and such. The changes in the fiber makeup. So Olympic sprinters have been found to have a crazy amount of fast twitch fibers, up to 80%. And we talked about how 50% muscle fibers fast twitch were the average for what you were born with. Marathon runners running at an Olympic level have actually been found to have the opposite, up to 80% slow twitch muscle fibers. So you can't be an Olympic marathon runner and an Olympic sprinter. I don't know that I've ever heard of that. The muscles are just not trained to do that. It's one or the other. So there's a debate over how much we can change our muscle fiber makeup versus training versus what we're born with. And what's been found is that it's a little bit of both. So oftentimes at a young age, if someone's born with, say, 60% slow twitch muscle fibers, they may learn that they are great long-distance runners, continue to train in that more and more, and then increase their slow twitch muscle fibers to even greater. And the same is true with the fast twitch and sprinters. So now we're going to go over the effects of resistance training on the heart. So for resistance training, this is going to be different than the effects of the cardiovascular endurance training on the heart. So endurance training with aerobic exercise produces very different effects than resistance training. Resistance training is due to a pressure overload, not due to a volume overload. With exercise that is quick, there is not enough time to increase stroke volume. So there is no volume overload. Instead, blood pressure goes up and the walls of the heart thicken, but the heart does not dilate. And because the heart does not dilate, there is no volume increase, and this is dangerous. So you have a thickened heart without a volume increase can sometimes close up the heart and cause an arrhythmia. For this reason, I see a lot of weightlifters. It's never recommended to only do weightlifting or strength training without aerobic exercise. Anyone who is a weightlifter should also be incorporating aerobic exercise into their routine, whether they are warming up by running on the treadmill or exercise bike or elliptical. That way they can, you do not want a pressure overload solely as a cardiac adaptation. So resistance training effects on muscle. So the first adaptation, a lot of people that do weightlifting want big muscles, but that is not the first adaptation. The first adaptation is an increase in strength, which is also great. So what happens is it's due to a learned process. The body becomes more efficient at what it's doing. So if you go ahead and bench press at 150 pounds for a couple of weeks, your body will become more efficient. The motor units will become more efficiently recruited in the muscles, and you'll be able to do the activity better, essentially. But the muscle size won't increase yet. Size increase is a later adaptation. So the goal, microscopically speaking, of weightlifting is to cause chronic micro tears in the muscle. There's a narrow window for that. If you don't cause any micro tears, nothing will really happen. But if you cause macroscopic tears, instead of microscopic tears, you're going to be left with major injuries. Then you won't be able to weightlift, and there will be bigger problems. You'll lose all of your adaptations. So, when done properly, weightlifting causes micro tears. The body will rebuild the micro tear. It will learn, I need to build the muscle stronger in order to withstand that amount of weight. What will happen is you'll get macroscopic changes of the muscle because the tears are rebuilt with a greater amount of muscle filaments. It's supposed to prevent future micro-injury. Good weightlifters will then increase their weight by just enough to cause more micro tears, and then the process repeats itself and the muscle rebuilds larger and larger. Resistance training's effect on bone. So muscles attach to bone via tendon, and what happens is any pull on the muscle also pulls on the tendon and the corresponding bone. The body will rebuild the bone in the same way that it rebuilds the muscle. It rebuilds it stronger. It puts more calcium in. It lays down more bone, and you're left with a stronger bone, which is great. This is a great way to stave off osteoporosis in older patients. So a study was conducted. This study is a little outdated, but I think what it shows is important. So I included it by Matalazzo and Snow in the elderly population. So we look at the amount of exercise, the intensity of exercise that is needed to increase bone mineral density. So what was demonstrated is that those who have a higher intensity resistance training have the greatest benefits. They have the most bone mineral density that forms. With moderate intensity, they have still some benefit over those who do not train at all. So a lot of our older patients, that aren't able to do heavy weightlifting, this is an important slide because anything is better than nothing. If it's band exercises, if it's a 1 pound weight, if it's less often, anything they do will provide some benefit. So it's important to let our patients know that something is better than nothing. So putting it all together, we've discussed the physiologic changes of aerobic exercise on the heart, on the muscles. We've discussed the physiologic changes of anaerobic exercise on the heart, on the muscles, on the bone. How should we incorporate exercise into our lives? So, a combination. They each have their own benefits. Now, we know that if we do anaerobic weightlifting on its own, that can be dangerous, so we have to add in aerobic. If we do aerobic exercise on its own, that has a lot of great benefits. However, you're going to be missing out on the strength benefits of the muscle and the bone that we would get with strength training. It's important to tailor to the individual's approach. Overtraining, something I see all the time in sports medicine and what I do. All overtraining does is lead to injury, and all injury does is shut the person down. And when the patient is shut down from exercise, they lose everything that they've worked for. So to try to push through an injury is not the answer. So a person has to find their ideal amount of exercise that's going to give them what they need to get the benefits without going overboard and causing injury. Of course, competitive athletes will be training in one area mostly, but we've all heard of the term cross-training. Cross-training is highly encouraged. Even competitive athletes that are training in one area, it's not good for them either. So, for example, there's been a large high increase in ulnar collateral ligament tears of the elbow for high school baseball pitchers, because now high school baseball pitchers are pitching in the fall, the winter, the spring, the summer. They're going to tournaments out of season. They're going to showcases. That's not good for the body. You're overusing one area and not using the rest of your areas. I have runners that are not gaining strength and they're getting overuse injuries. So cross-training for competitive athletes and for the general population is strongly encouraged. Exercise recommendations. The Department of Health and Human Services has issued exercise recommendations of at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise. Intensity is really decided by how much the heart rate increases. Strength exercises should be done at least twice a week, although they did not list a time frame for that. So regular exercise can help keep a person youthful and fight the effects of aging. We're going to go over how it can allow a patient to do life's activities more easily. But one thing I'll say in relation to this slide, I see patients at Cedar Crest, which is an older age campus in the Pompton Lakes, Pompton Plains region. And I see a wide range of patients from their 70s up until their upper 90s. And one thing that is a constant without a doubt, those who are moving are high-functioning 90 and 95-year-olds. Those who are sedentary are low-functioning, wheelchair-bound, decline quicker. Exercising into your later years, it just makes a massive difference. And I see it over and over again. So let's go through the benefits of a regular cardiovascular exercise program. So as I said before, energy. Having more energy and less fatigue allows you to do several tasks in a more efficient way. It allows you to keep up with your children and grandchildren. Walk to the store if it's within walking distance. Climb stairs. A lot of homes have stairs. If you have to run to catch a bus, if you're going grocery shopping, you're not going to be out of breath. Just the activities of daily living. The benefits of regular strength training. As we age, we naturally lose muscle mass. It happens more rapidly as you get into your 50s, 60s, 70s, 80s. If you're not exercising, that's going to happen even quicker. You're not going to be able to lift things around your house, for example, or lift your children or grandchildren. Muscle tissue is also a calorie-hungry tissue. A lot of calories are burned by having more muscle mass. So if a patient has a high percent body fat, they're not going to burn as many calories. It's going to be hard to lose weight. Adding muscle tissue, a lot of people say, well, what's the best way to lose weight from an exercise perspective? You know, people don't want to do strength training because adding muscle mass will gain weight. True, but adding muscle mass will help lose fat because it's a calorie-hungry tissue. So strength training and cardiovascular endurance training, a program should include both elements for proper weight loss. And of course, doing strength training can help limit the decrease in bone mineral loss that happens with aging, can help to stave off osteoporosis. Additional benefits. So, like I said, they both promote weight loss. Weight loss has just an innumerable amount of benefits on its own. That's a whole nother lecture. But with weight loss, insulin sensitivity is increased. This reduces the risk for diabetes. Abdominal fat is decreased. That decreases the risk for heart disease, stroke, several types of cancer. HDL, or the good cholesterol, increases. Increased HDL with regular cardiovascular exercise is another way to limit heart disease, prevent heart disease. So this is the end of the lecture. I hope you all got a lot out of it. I apologize for the technical difficulties, but hopefully you could at least see the slides and hear me. And if there are any questions, maybe Lisa could let me know.
And right now we don't have any questions, but as a reminder, the text chat is located on the right-hand side of your screen. So if you'd like to submit a question, just type your question into the small text box at the bottom, and when you're finished, click the send button. And as we wait to see if we have any questions come in, do you have any final thoughts?
Well, I would say that it's interesting to see. We see in our patients all the time. We recommend exercise every day to our patients to be healthier. It's fascinating to see what happens on a cellular level that is the cause of the benefits that we see from exercise.
Okay, thank you very much for your presentation. And on behalf of Atlantic Health System, Morristown Medical Center Orthopedic Surgery, and the Department of Orthopedics at Chilton Medical Center, I would like to thank you for your participation in tonight's event. You will now be redirected to the post-event survey requesting your feedback. Please take a moment to complete this survey in order to receive credit for providing feedback and attending today's webinar. Again, this concludes tonight's program. Thank you and have a great rest of your evening.